Hi, this is Linda McGee, the multicultural psychologist. So glad that you all are joining us today. Today, I had somebody that I had to chase down to find. Our incredible schedules took us months to get this together, but I'm so happy to welcome Dr. LaNail Plummer, who has written the Essential Guide for Counseling for Black Women. Welcome, LaNail.
Thank you, Dr. Linda. How are you?
I'm doing just fine. I'm doing just fine. Even I'm happy that we're recording this between my semesters and I
Yes,
get a little bit of a breather. But and we're also recording this the day after Mother's Day. So I just want to acknowledge because we're going to be talking about Black women,
yes,
acknowledging our mothers, acknowledging ourselves as mothers,
right.
and just the respect that I have for mothers worldwide because it's the toughest job in show business, Dr. Linnell.
It really is. It really is. Yeah. Happy Mother's Day to all the folks. And as you said that, Dr. Linda, it also made me think about um how we are celebrating our mothers, our grandmothers, our foremothers, celebrating ourselves. And I have a 22-year-old daughter who just graduated from North Carolina A&T this past weekend as well.
My
And
goodness, congratulations.
thank you. And I also think about how I will eventually be celebrating her as a mother too, and how
Hmm.
at this point in her life, how I am raising her and rearing her and guiding her to be a future type of mother as well, like correcting myself. And I think that's part of that is addressed in the book, but correcting part of my experiences and the experiences of my foremothers so that my daughter could be a different type of mother and the kind of mother that she's purposed to be as well. So shout out to those who are going to be future mothers and who are taking time to address and heal themselves right now so they could be great for the generations that are here to come.
And that just dovetails so nicely into some of the work that I'm doing about what I'm calling now self-care and self-healing.
Yes.
And I was just so happy that you used some of the phraseology of healing self
Yeah.
and centering self, which is what I'm working on really about understanding the things that decenter us so
Yep.
that we can center
Yeah,
ourselves.
absolutely.
So tell me, doctor, how did you get into this work?
Ah, I mean, how long is this podcast? So
We got a minute. Go on.
the I think I was purposed to do this work, So how did I get here? I think there was lots of avenues and I was obedient to spirit to make sure I did the right thing. But as a young person growing up in Southern California, I was surrounded I lived in poverty. I lived in a neighborhood where there were lots of folks who were struggling to make it and who were the recipients of systemic oppression and they didn't find their ways out. It was hard, right? Like they were going against systems. And so a lot of them were falling into different types of coping mechanisms, such as substance use, that was preventing them from really fulfilling their purposes and their dreams. And that includes my own mother, who had her own addiction as well. So when I was a young person, I was curious about decision making. I didn't understand systems. I didn't understand racism and things like that. I was in a Black neighborhood, Black and Latino neighborhood. And so that's all I knew. Our teachers would come in and they happened to be white. And our social workers were around and they happened to be white, but everybody else that was around us were Black and Latino. And I got curious around like, how do some people get to be teachers? How do some people get to be social workers? How do some people get to, have a business and the rest of us are not? And I thought at a young age that was around decisions. Like people just aren't making good decisions because
Hmm.
while my mom had her substance use issues, I had a really great relationship with my grandmother and my great grandmother and my aunts and uncles who would always tell me, make good decisions, LaNail, make good decisions. If you make good decisions, your life will be good. And I was like, well, how do some people make decisions, good decisions, and healthy decisions, and others don't? And then as I continued to get older, I got interested in forensic psychology, because that is a deeper level of decision making, right? And to some degrees, the hardest level
Very.
of decision making. And when I attended Howard, I majored in justice and in psychology because I wanted to see the intersection of two and how it affected our people in particular. And being educated at Howard was a great place for me because it was so focused on Black experience so that I could really dive into what I thought was important for me at the time. Eventually, I came into counseling, right? So staying on that path, but I came into counseling because of a work study program. So I'm excited about work studying. And I recognize that right now, some of our systems and some of our resources are under attack, but work study
Mm-hmm.
elevated my experience and my passion for
Mm-hmm.
mental health. And then doors just started to open for me. And I started my career in working with young people, elementary school students in particular, because my thought was if I could intervene on their experiences, then I can help them make better decisions as they grow older. So the theme continued to be the same, even as I learned about systems and systemic oppression. But then, we learned, Dr. Linda, that you can help children, but they don't have autonomy. So you have to help the family. And in helping the family, I created a wraparound services at the school that I was working at. And we provided a full clinical experience for students, for families, and for their teachers, because we were treating them and giving therapy, but then sending them back to the classroom, which was also triggering for them. So that's kind of how my work started. And from there, I started teaching. My interns would, tell their department chair they wanted me to teach. So I started adjuncting. And now I am the department chair at that university, Trinity Washington University, and had beautiful experiences in between at both Marymount University and Hopkins. And I'm also the CEO of Onyx Therapy Group. And I love all the work that I get to do. I love the public scholarship and the podcast, but what it's really about is helping people create self-awareness so that they could again go back to making decisions that feel good for them, in the understanding of the fact that there are many systems that are in place that try to keep them down, whether that's racism or patriarchy, or even for our listeners who are not, for our listeners who are white men. There's also power in their experiences and how they hear our understanding and decide how to elevate others because of it as well. So I guess that's the shorter end. I'm also a veteran. Shout out to our military service members, and I'm a dependent of a veteran. So again, justice is extremely important to me
Right.
as a soldier, and in watching my father also being willing to sacrifice his life to make sure that justice was formed at the national level.
I think so many things just came up for me when you were speaking. One is just that coming out of systems and coming out of poverty and wonder who makes it and who doesn't,
Yeah.
and just the access to resources. I was in the first start Head Start class in the
Yeah.
United States.
Yeah. Okay.
And so, you and I were talking before we came on about, reading at a young age and having those people behind you. I grew up in a small town that it was is, white, mostly white, and but to have that community behind me, and even to this day when I go to that town, you the one that left and went to college, and you know what I mean, like I'm known as that person,
Yeah.
right, that left. And but just thinking about how sometimes it's just so we're up to the hands of fate as to
Yeah.
who gets out and
Yep.
who can make a fulfilling life, and who doesn't get that opportunity.
Yep. Yep. Absolutely.
uh,
I 100% agree with that. And for so long, Dr. Linda, it wasn't a struggle. It was just years worth of processing. Like, how is it me? It wasn't like a survivor's remorse
mhm,
or guilt or anything like that. My family is extremely supportive. My family is very supportive of who I am. And they tell me that all the time, even to this day.
mhm.
Um, and they tell me that without asking for anything. It's not like they are supportive and they're saying, now give back to me. I give back naturally, because that is who I am. But I have wondered for years, like, how was I the one that was chosen? But when I give gratitude to God, to the universe, I'm grateful for that he did choose me, and
Mhm.
that I have done well with the opportunities that he's provided for me. But I do recognize that it's a matter of timing, it's a matter of placement, it's a matter of purpose, and what we continue to do with the opportunities that are faced in front of us. Some folks tell me, I've never had an opportunity. And I said, just talking right now with me is an opportunity because
Mm-hmm.
of who I know and how I can help out in certain situations. But there are times when folks won't talk, they
Mm-hmm.
express what they need. They won't be humble, and our egos really get in the way of us pursuing our purpose. You know,
Right.
egos get in the way of asking for help. And
Mm-hmm.
there's reasons behind that. There's a whole system behind why.
Yeah, I was gonna just say that what we're calling what looks like ego is this person that's been beat down. They're scared to put themselves out there. They've been hurt so many times. The system haven't kept their promises.
Right.
We both came out of schools, and
Yeah.
I worked in learning disorder schools while I was in school. And when I came out of school, the reason why I switched over to non-learning disorder schools is because I had a child, and
Yeah.
he could go to that private school.
Yeah.
So I
Yeah.
went to the Shishi Frou Frou schools from the learning disorder schools
Yeah.
so that he could go for half price.
That's right. That's right.
um but yeah, what a lot of the popular mental health speakers, they talk about ego, but it's like it's a guise for being hurt. It's just like when people are arrogant sometimes, and they put their arrogant front up.
Hmm.
It's like really their trauma speaking.
I agree with you, Dr. Linda. I do agree with you. I also think that sometimes it's classic Freudian ego. Sometimes
Yes.
sometimes they are protecting something, and
Mm-hmm.
whatever they're protecting is not worth it in that moment, right?
Right.
Like, of course,
Right.
as Black folks, we have to put on an armor. Like, that's not even an option for us. And that armor is heavy, but we don ourselves every day. But what may be missing in the conversation is how we use discernment in terms of whether we continue to keep that ego armor on
Right.
or whether we let it off or not. Because if we are always protecting ourselves, we're never in a position to really receive the opportunity. And I'm not saying that from a place of like, just go out there and show everybody all of your vulnerability. Absolutely not. But there are moments where we have to ask for help. Even now, in owning a company and being a department chair and doing all the things, I have to still very much take the strategic risk of asking for help and knowing that that risk means that my feelings may be hurt. That I, but what else do I have in my system to be able to help me fill my cup back up if I
Right.
feel depleted by
Y-
hearing the no or by being rejected in a situation. And that goes back to what you were saying about self-care. As we continue to fill up our self-care and we have our resources around us and we have our people around us, we're willing to take certain strategic risks because we know that ultimately we will be restored.
Since we're in that direction, I wanted to articulate something that came up for me in the book.
Yeah.
When I was seeing clients, a lot of times when they were African American or Black, there would be issues where race would come up in their jobs, race would come up in their doctoral programs. And one of the real complexities of seeing African American clients is even if you are Black, is sorting through identification with what they're going through, over identification with what they're going through, and helping them sift through what you just basically said. It's like sometimes it's ego and sometimes it's pain, right? And I think, like in our countertransference,
Yeah.
it's sometimes even difficult for us because we had start to identify with the racism, and it brings up our own issues. And I think for therapists that aren't of color, they're afraid to challenge, go underneath the surface of what the person is saying, and saying, with that, obviously acknowledging that racism does exist and that it does impact systems. But like one of the goals of your book is to come up with some practical ideas and approaches and problem solving, what you said earlier, decision
Yeah.
make around those issues. And so I just wanted to throw that out there about the complexities of dealing with, like this might be a racial issue, but also like how the person is like letting themselves be subsumed with it. Does that make sense?
Absolutely, absolutely. And so I love that you mentioned that. The book is called The Essential Guide for Counseling Black Women. And I wrote it for two audiences. I wrote it for Black women and I wrote it for clinicians. And sometimes there's going to be an intersection of which the clinician is also a Black woman, right? And so there's things that she is reading and processing and thinking like, oh my gosh, I could understand and relate to that. And sometimes it's a clinician. Let's take, for instance, a white male clinician, like you just mentioned, who is afraid of asking certain questions because they don't know how to make the distinction themselves. Well, to me, what I teach my students is that that's also a form of countertransference. If we are avoiding asking certain things, it is because of our own fear. And you know,
Mm-hmm.
classic level of countertransference, it's when we as clinicians are centered as opposed to our clients being centered. So if my fear prevents me from asking my client a question because I don't want to seem ignorant or I don't want to be triggering or whatever the case may be, that's actually not helping the client. The relationship that that client forms with that clinician by asking a very intentional and clinical question could actually be a breakthrough for that client. And it could be wonderful and developmental for the clinician, but it's not about the clinician. It's really about, are we asking the questions that the client needs in order to understand? I wrote the book though, Dr. Linda, because people need to be intentional about the questions that they ask. And that's why I have the catalyst questions that are in the book. Like, don't read this section and then just go out there and willy-nilly the question, like, or don't
Right.
section and willy-nilly the question. No, use the catalyst question because that is helpful. Use the journal prompts that are at the end. Assign those to the clinician or to the client, but also maybe use those as your questions. Use the therapist tips. Use the therapeutic guide, right? Like I give you the therapy and the solutions and the interventions that you can use. And then with that, most importantly, as you and I are having this very specific conversation, use the therapist introspection, of which each therapist is asked about their own countertransference, about their biases. And sometimes we need to be asking ourselves those questions independently of another person because of the shame that we experience when we realize that we had judgment and biases towards somebody or towards their situations. And it's important for
Right.
us to be, as Black women, to ask ourselves those questions too, because we have biases too, Dr. Linda, right? Like we see other Black folks and we may be judgmental. And sometimes I'm going on a tangent, but sometimes our religion tells us to be judgmental, right? Our religion
Right.
judge a tree by the fruit that it bears. And so we sometimes find ourselves in a justified place, our perceived justified place of judgment, and that is preventing us from having our own self-awareness and preventing us from growing ourselves because we are now afraid that somebody else is going to judge us. And so subsequently, we're just out there, like judging
Right.
people, afraid they're going to judge us. And in all of this process, none of us are healing, none of us are growing. And in fact, we may be causing more pain for ourselves and the next generation that's coming behind us.
Well, we're gonna come back to that. Trust me, we're coming back to the crabs in the barrel. We're coming back to all that. Okay, I read it all.
Okay. Okay.
But what I wanted to just underline and emphasize is that I found myself looking at the catalyst questions, the therapist stuff, but I was working through them as a prelude of my own self work.
Yeah.
Right? What do I need? So I was looking at your therapist tips, and I'm gonna get to that in a second. But I was using the questions that we were like posing and homework we were posing to the client as myself. So that's one of the things that I really liked about the book
Thank
is
you.
that you could work through all of it as a therapist,
Yeah.
right? As particularly as a Black woman. And I was telling you about some of the lists that I was going through. I was like, oh my God, this is me. And a lot of us are the person in their family. Um, I'm the ninth of 12 children, the first person in my family to graduate from college. And so I know about the positives and the negatives of all of that, but I wanted to emphasize that, you're at Trinity, which I've taught there. So that's a wonderful, I love the fact that they have a lot of people that are already in schools that
Yeah.
come back to do it. So I just love that program. But I'm across town now at George Washington
Okay.
and in the forensic and the PsyD program, and the students always ask, like, what do I say,
Yeah. Yeah.
right? How do I bring that up?
Yeah.
That comes up every single class, and in my diversity class, and even in assessment class, this situation comes up, like, what do I say?
Yeah. Yeah.
right? How do I handle this situation? So the therapist tips is like one of the few, books. It says, well, you could ask about, what would you want your child to say about you? That was one of the things that the first trigger point for me in the book
Yeah.
was I saw something someone said to me, and my son said to me something about being selfless. And I was like, okay, that's good, right?
Yeah. 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 Yeah.
I mean,
And
it's good to a certain extent, but it's not good unchecked,
yeah.
right? And so, like, I was just taking the question from the book and like extrapolating it to a
Yeah.
situation,
Yeah.
and I was like, oh, okay, so I'm out here doing these self-care, self-healing things, and maybe I need to check on the selfless, okay,
Yeah.
right?
Absolutely. And Dr. Linda, that happens, especially for us as Black women, because that's what we're socialized to do. We are socialized to be unchecked, selfless, right? We are told to give everything that we have. And the moment that we take a little something or keep a little something for ourselves, we are automatically miscategorized as selfish. And that's not it, right? Like we need to, I think about the airplane, when we're on the airplane and the flight attendants are saying if an emergency happens, put your mask on first and
Right,
then put on the mask of the child, because if you put that mask on that child first, they may survive, but then they may survive this plane, but then they will not have their parent for the rest
right,
of their lives, right?
right,
But if you put on your mask first, you will move quickly as a form of survival and then put on that mask for that child, and you all will be able to still be together for the rest of your lives. Like, it's not
right,
just about that moment, it's about the continuation. And so I too am big on self-care, because that is how I need to keep my cup full, to be able to raise my children, to be able to support my clinicians, to be able to be with my clients, to be able to teach my students, to be able to be in this world as a Black woman, knowing that at any point somebody may say something crazy out their mouth. And I need to be able to respond in a way that reflects that I have been raised properly, but I also got a little edge to me, and you're not going to talk to me like that, right? And
right,
so, but
right,
my cup has to be full, because if it's not, then I can respond in one way that causes, generational issues, because
right.
we know that we're
But
experiencing.
the systems that govern, like the patriarchy and the
Yes,
system of race in the United States, has us like though turned all around and
yes,
upside down.
yes.
And even within the Black family, it's sort of like you're conditioned to always put self first. I remember a time when I was trying to get on the path of taking care of my body,
Mm-hmm,
right? I
mm-hmm.
couldn't even go up the steps without being out of the breath. And, so I wanted to take this class, but it would have involved me being my child being in aftercare for 33 minutes,
Mm-hmm, mm-hmm, mm-hmm.
right?
Yeah,
One day a week,
yeah,
Dr.
yeah,
LaNail,
yeah,
right? And
yeah,
it took me months
yeah,
to
yeah,
do it, to do that one act for myself, which
yeah,
eventually led me to a really good place in
yeah,
terms of, but it took me months because I was like, I'm not going to be a good mother if
yeah.
if I don't pick him up every day at the exact time he walks out of the school.
Yeah. And you know what, Dr. Linda, I'm not even surprised that was a struggle in that period for you. Like I mentioned in the book, baby girls are given baby dolls as early as 6 months old.
Hmm.
Companies are marketing baby dolls to babies who can't even go to the bathroom by themselves.
Hmm.
You know what I mean? They are
Hmm.
being socialized and conditioned to take care of something else before they can fully take care of themselves. And that is what we are experiencing as women, right? And then it's compounded by that with the Blackness, when we are always told that we have to take care of everybody else. And the guilt that comes for that if in that moment you choose not to, right? There's a section in the book where I'm talking about work is legacy, where I mentioned what happens if the client doesn't want to take care of anybody else. She has to deal with the fact that people are going to call her names, and they're going to say that she's not about the community and she's not about these things. But don't we all get a choice? Like, why do non-Black people get a choice and Black people don't get a choice? That's all about socialization, and then it's subsequently our decision making process. But I needed to call all of this stuff out, because there's so much that we've been socialized with that we think is natural. You know, people are always like, well, this is just natural for me. No, honey, that's not natural. That was purposely conditioned for you based off of your race and based off of your gender. And now you believe that it is natural. And so you feel bad when you want to go against that, but it's causing other health issues. It's causing physical health issues. It's causing mental health issues. It's causing generational trauma. It's causing all sorts of things because we have not been able to distinguish with what has been part of our socialization as Black women versus what is actually natural for who we are as people. In fact, I believe, and it may be controversial or not, I believe that Black women have been socialized to eventually kill ourselves, like not in a suicidal way, but in a detrimental kind of way. You know, we will go into exhaustion. We will
Mhm.
have all these health issues, like you mentioned. We will have hard times walking up steps because we are doing everything for everybody else, and they like that because
Right.
they don't have to do
And you don't
it
even
anymore.
see it. Like I just remember looking at one picture of myself and just thinking, "Oh my God." Like it wasn't even like the size or anything. It was just that I didn't look like I was caring for myself,
Yeah,
right? Just the look on my face and you know what I'm saying? It just made you really go to a place where it's like I need to do something different,
and you know,
right?
our ancestors were beaten and bruised and lynched and hung and all sorts of things, and the systems that have been put in place since that has ended put us in a place now where white folks don't have to do that to us because we're doing it to ourselves. They don't have to silence us because we silence ourselves. They don't have to, you know, cause health issues for us because we cause it for ourselves.
Right. And it becomes so internalized.
Yeah, and I
It's
mean
like
that's
you don't, you know, I used to tell parents, like you said, you met with parents. I used to tell parents, you don't have to say you got to go to Harvard anymore because you said it 57 times and
mhm,
now it's imprinted in your child. If you never say it again, it'll be imprinted in them that they'll be
mhm,
a failure if they don't go to Harvard. And
right.
the same thing that happens in systems is that that's so frustrating, right? And
Yeah,
it's frustrating to work through yourself, but it's also really frustrating as a part of today's debates. It's like you do know that's internalized racism, right? Like you internalize, you know, that you should speak negatively about Black women,
yeah,
right? I wanted to go back a bit because you made a point at the beginning of the book that you were including trans women,
yeah,
and I
yeah.
want you to speak to that, please.
Yeah, yeah, absolutely. Because this book, depending on where a person is in their gender identity journey, if they identify as a woman and they go out in the world and live their life as a woman, people are going to treat them as a woman. And so they need to be able to be included in any conversation that we have about women, whether a person has a political perspective on whether someone should be identifying as a woman or not, doesn't matter. That person is treated like a woman. Um, and 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 that's just a matter of fact. And you know, this book wasn't supposed to be political. There's elements of it that's controversial, I'm sure, as there's a revolution that is forming or has continued to form. But for our trans folks, they need to be included based off of how they identify. And that's important to me as a person. That's important to me as a spiritual being, right? And recognizing that spirit matters more to me than the flesh. And that matters more. That matters to me also because I identify in the LGBTQ community. And while you know LGB is about sexual orientation and the T is about gender orientation and identification, we are still all in the same community. And anytime I have a position to advocate for those who have been marginalized or who are unseen, I will use that. And this book is for Black women. And if a person identifies as a woman, then this book is for them. And it's
And,
for clinicians who are helping us as well.
and people that I tell my students, people that want to grow as a clinician.
Mm-hmm.
right? That's why I chose culture writ large because of all of the intersectionalities,
Yeah.
as opposed to, a race show because you see so many clinicians that are just resistant
Yeah. Yeah.
expanding to learning, and they just think that magically they've circumvented the system of unconscious bias and microaggressions just because by virtue of a PsyD or whatever. And so like I wanted you to just speak a little bit to the identities of Black women.
Yeah. I mean, so many identities. I think where I would like to go with that particular question is something that you said earlier around teaching in your diversity class, in your diversity course, rather. I've had the opportunity to be a counselor educator for about 15 years. So a large majority um, of my career has been at an intersection of both being a therapist and maintaining the caseload while also being a counselor educator. And what I found is that there's many times where clients are coming to me with challenges or talking on behalf of people that they know, and they themselves are in counseling and not getting the support that they need, right? Because people don't understand their identity. And so one of the reasons that Onyx grew very quickly, we've been in business for 13 years, and one of the reasons we grew very quickly is because clients came to us because we were Black women, and they said, I want somebody who's relatable. And that feels good to me. It feels purposeful. It feels, driven in so many ways. But Onyx is not the only Black woman owned company. And at the time, 13 years ago, there were other Black women owned companies, but we're still not enough. And when we compare ourselves to other mental health companies, there are far more white companies, and there are Latino companies that are coming up, and Asian companies that are coming up, and our indigenous people, and they are having mental health companies that are coming up as well. And but yet those Black women can't all be seen in Black women practices, right? They need to be seen in other practices as well, just based off of access or based off of insurance or based off of proximity. And so the book needed to be written for those counseling students and for those non-Black folks and Black folks too, because of countertransference, who are working with Black women, because
Mm-hmm.
the diversity of our identities. We are Black, and the book starts off with that part one. I break down the historical elements of our identity. We are Black, and we cannot separate ourselves from that. And we are women, and we cannot separate ourselves from that. But we are at the intersected identity of which both systems only work because of our existence. Racism only works because Black people are here, right? And patriarchy only works because women are here. And we can't remove those two things from ourselves, which means that these systems continue to go on until other people start to address them, which means that we are perpetually in a position of being oppressed. Because even if one system is dismantled, even if racism is dismantled, if patriarchy is not dismantled, we are still being oppressed. Even if patriarchy is dismantled and racism is not dismantled, we are still being oppressed. So, what do we do? Because we know that we are in these double involuntary minority positions of being oppressed. What do we do to intentionally empower ourselves moment by moment? This is not a what do we do annually when we write our resolutions. This is not what do we do monthly when we set our monthly goals. This is not what we do weekly when Sunday evening comes around and we think about our weekly plan. This is what do we do every single day. What do we do every hour? Here I have my tea in the mugs that I love, and I have my water, and I have my Palo Santo, and I have my incense, I have my book. Like, what am I doing consistently to make sure that my cup is filled? Because I know that at any point, because I am at this intersected, involuntary minority position, somebody may pull something from me that tries to devalue who I am. So I have to continue to validate myself, and I need to be in therapy, and clients like us need to be in therapy to continue to have positions and self-awareness to understand how do we validate ourselves and how do we expect people to treat us and how do we hold them to that expectation, or as we call it now, boundaries, without losing yourself in that process.
That kind of brings me to the part of the early part of the book where you talk about women taking different paths now,
Yeah.
right? And choosing the non-traditional.
That's one of my favorite chapters.
It just like earlier you and I were talking about social media and we have had some pretty painful conversations within the Black community over the last few years.
Yes,
And
that's
they've
right.
been internal, and social media has been a part of it. And while it looks bad and sometimes it feels bad, I think that they're very useful.
Yeah,
Some of the things that we have talked about is like religion, the role of religion, and
yeah,
who's black,
yeah,
uh, you
yeah,
know,
yeah,
why aren't black women backing black men in the way that they feel like they should be backed, and black women are like, we back you, but we have boundaries and we have, so I just want you to speak to whatever from that chapter that you say is your favorite, like what really motivated you to do it, because I felt like it was one of the chapters that really captured, I think, the zeitgeist of Black America right now, where
yeah,
people are like saying, look, I might as well do what I want,
yeah,
right? And make myself happy
yeah,
as opposed to everyone else.
yeah. And precisely for that reason, Dr. Linda, precisely. I wrote the chapter because sister girls are out here doing all the things, and I want them to continue to feel empowered in doing all the things, but that means that we have to process it. If we just mentioned Mother's Day, and shout out to the mothers, but also shout out to the women who made the intentional decision that they didn't want to be mothers. Like, that was a very intentional decision for them. They wanted to focus on whatever they wanted to focus on in their lives. And yet when they go home for their family reunions, Nana is sitting there like, and why you don't have a baby yet? And their homegirls are inviting
Did
them
I
to all
get that
the
question? I got
right.
$1 for every time I got that question.
Okay.
When
And
you
then,
having a baby?
we decide to move to different parts of the country or move out of the country for our own reasons. And someone is saying to us, now, why would you leave your family? What about your cousins that need you? Like, we could feel very strong and empowered in our decision, but still have to face our family and our support group who is consistently questioning us. I have had many clients who do not want to go home for the holidays, not because there has been trauma in the family, but because they don't want to have to answer questions from their elders, because we were told to respect our elders and to answer the questions of our elders, of which we should, right? That is spiritually and ancestrally who we are, have respect for those who came before. But it is difficult to answer those questions if you haven't processed your decision for yourself. And it is difficult to answer those questions if you don't feel empowered in those answers as well. If you believe that you could be easily swayed, because then it puts you in a position where you're either going to lie to those folks and be dishonest to yourself, or you're going to do something that is not true to who you are just to appease them. And in both situations, you lose a part of who you are. And I am not in the business of making people lose who they are. I'm in the business of helping them become who they want to be. That goes back to what you were saying a second ago, too, around the fact that people need to kind of be more empowered in certain situations. And because of the oppression that we are already pushed down. So it takes more effort for us to be empowered. And my goal is to use this book and to use my teaching and to use my business to empower people so that they could climb up to who they want to be and who they were purposed to be. So this chapter was one of my best one of my favorite chapters, because it is truly about empowerment. Some of the other chapters are about awareness. Some of the other chapters are about healing, but this chapter is about empowerment. Like, I want to do something and I don't know how to do it, or I want to do something and I've already started, and how do I stay on the path and keep that momentum of feeling strong in the decision, even if those around me don't understand it. And that, to me, doesn't feel that different from some of the most empowered people in our Black history that we respect, like, say, Harriet Tubman. She did what nobody else was, well, what was not fully documented. Other people were doing it, but she is the one who received the credit and the documentation for it. But she blazed her own trail. She did what she didn't have all these children and responsibilities and do the traditional route, because her purpose was to do something different that was empowering for her, and it eventually empowered us as well. So we see those models in our history, but when it comes to us individually, we think that we can't do it, and it's because of a sense of a lack of power. So that chapter was how I wanted to start off the book, because I want folks to feel empowered, and for therapists to know that when a woman feels empowered in that space, she still needs support to be able to process her decision and to continue to deconstruct it, so that when she is questioned by her family and by her elders and by her community, she can stick 10 toes down, as folks say, in her decision.
That just reminds me so much of just the rewarding nature of working with Black women in therapy. It's
Yeah.
just some of the most rewarding work. It's just to help them build their autonomy, to help them work through, I have value apart from everything else,
Yes, yes,
right?
yes,
And I have the power to make decisions
yes,
that are in my own best interest, right? And to plan, as one of the things that you talked about in the book is decision making, helping people show up their decision making. And in a way, it's sort of your way of implicitly saying decision making through trauma, right?
yes,
How do you
yes,
make good decisions even though you're dealing with systematic trauma
that's
and you're
right.
dealing with racial trauma? But, I just wanted to sort of put out there the joy of watching women become,
Yeah.
right?
My baby, I just mentioned, well, I mentioned earlier that my baby graduated from college on Saturday, on May 9th. And
North
and I
Carolina A&T.
North Carolina A&T. I'm a Bison, but shout out to the Aggies. I do truly love Aggies.
Yeah,
And she I made a post on social media about the fact that one of the best, many of the HBCUs have graduation on Mother's Day weekend. And sometimes you hear people saying, like, why do they do that? That's not good. Mothers want to be able to celebrate and all the things. But I truly believe that one of the best gifts, um, Mother's Day gifts, is to watch your child accomplish their own dream, right? And in this situation, it is my daughter, who is a young Black woman herself. And there's so many similarities between her personality and my personality, so many similarities between how she shows up in the world and how I show up. And part of that is, just based off of God. And then a lot of it is how she's been raised. But she sets her own dreams and goals for herself. And to watch another young Black woman come into this world and accomplish what she wants to accomplish, it doesn't mean that it's free of struggle. I've seen my daughter go through her own struggles, right? And I've seen her, whether that's social or health or whatever the case may be, but to see her still persevere and say, I still want this dream. I'm still going to do this thing. I'm still going to be out here accomplishing. Um, is important to me. It's beautiful for me and it's motivation for me. And I'm surrounded by Black women, whether it's related to my sororities and my organizations or my company or the students I get to work with or, the people that are just in my circles. And to be able to see Black women pick up that feeling of empowerment and push through these systems. The systems are here. And I'd like to say that they'll go away, but I don't know that. I don't know that, Dr. Linda. I don't know that. But what I do know is that I have been positioned as a mental health expert to give tips and strategies and solutions for how people can empower themselves in the face of oppression. And I've been positioned to be able to empower clinicians to learn how to work and serve Black women as they are also pushing through, right? So the book again is for Black women and it's doing really well with Black women and doing really well with clinicians, but it is also for clinicians to say, hey, I think I have some blind spots, right? I think there's a few things I need to process. And the book is great because it's individually read. So a
right.
person can say, I need to work through this. I need to be better for my Black women clients. I need to be better for my clients that are showing up in these spaces and wanting to do things. And I need to address my own biases and countertransference that may be preventing that client from really accomplishing what she wants to accomplish.
one of the most powerful sections was when you challenge therapists to look at their own internal notions about marriage,
Yeah.
about having children.
Yeah.
Because a lot of times I'll get a client who's been to another therapist, and this is where the ruptures happen.
Yep.
Is that they're in there with a conservative therapist, and person is like, talking about a spouse that's from the opposite sex, right, or gender, and they have already told the therapist that they're bisexual or they're gay, or I was at this conference, and it's going to remain nameless. With that, were there were a lot of African American and Black therapists there, and the discussion was really conservative,
Yeah.
right? And it was centered around, one of the guys suggested that, I need to retire because all of this stuff that's happening, and people want pronouns, and like, it was just a really rant about them not wanting to change. And so, like, I like the fact that you went head on
Yes.
our own people,
Yes.
right?
Yes.
And obviously the ideas and notions about marriage and having children go cut across, you
Yes.
know.
Yes.
But some of the patriarchal ways that are embedded in our learning, our readings, our curriculum, our teachers, our therapists, really, I think, are an impediment for Black women clients.
Yeah, absolutely. 100%. And that's why, like you mentioned, it had to be addressed head on. I didn't have a whole lot of space, I think, with the table of contents and the appendix. The book is only a little over 200 pages. And so part of that is because I'm an active reader myself. It's 188 pages of direct content without the index. I'm an active reader myself, and I know that at some point a person can lose interest. So I wanted to get all of this information in there in a very compact kind of way, with tools, with tips, with tables, with guidance, so that we could get to the root of the issue. And you and I teased a little bit earlier, but I'm a Virgo, and so I'm very much like, let's be direct on the issue so we could get to the solution, so we could get back to the healing and the healthy living that we want to have, right? And so I needed to be clear and direct so that I don't lose interest, that the reader doesn't lose interest, but they also feel supported as they are making their own transformation. And even the book itself, the cover was intentional with the butterflies that represent transformation. And so I wanted the Black woman who was going through the healing process to feel like a butterfly, and the clinician who is exploring themselves and helping their Black woman to feel like a butterfly too. We can go from a caterpillar through that chrysalis process and then come out and transforming into who we want to be.
Right. Like I was saying, I felt like I was just like flitting back and forth between using the material as a Black woman for my own self work, and then using the therapist tips. And one of the things that I thought um, was ingenious about the book is that you support various theoretical orientations and you give guidance on those areas. So, can you speak to that a little bit?
Yeah, that's the educator in me, right? So I get the opportunity in being a counselor, educator, and teaching various courses, and now I'm being a department chair and knowing about all the curriculum that's required. Um, Letting folks know what theoretical orientations and therapeutic modalities I align with that particular work and chapter, and 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 a person doesn't have to stick to that therapeutic modality, but it's also a reminder that we do have therapeutic modalities and we do have theoretical orientations. Because Dr. Linda, you and I know that folks will get out in the field and they'll be counseling for 10 years, 15 years, and they sway away from an orientation, right? You
Mhm.
ask what's your orientation, and they're like, oh, I'm eclectic. That's a real cute word of saying I do everything, but I don't have any grounded. And I don't, no disrespect to the eclectic folks out there, right? But what is
You're
your
gonna hear from them though.
what'd you say?
Go hear from them though.
Oh, I'm sure. I'm sure. But what is your grounding? I tell my students and my supervisees, your theoretical orientation, if we were to put this in a roadmap, like a GPS system, your theoretical orientation, your orientation is how you orient. That is your home base. That is your starting line to whatever the definition or whatever the destination is, which, and that destination is your client's therapeutic goals. So you have to know how you are starting your process. And then your therapeutic modality is the street and the route that you take to get to that goal and get to that destination. But you must know your starting point. You must know your orientation so you then know which therapy to use. You could have, so eclectic folks don't bother me because I'm not troubled by their work because they could be using different routes. The
Right,
challenge is they don't have a home base. You need to
right,
have a home base. Where are you starting from? And then your eclectic therapeutic modality is the different routes you take. I live
right,
out here and there's a Target near my house. There's three different ways to get to that target, right? Depending on what I am doing along that route, if I need to go to the bank, then I'm taking this route because I could stop at this place and I could stop at that place and still get to my destination. Your therapeutic modality is the route that you take with your client so that many things can get accomplished.
right.
But you have to again know where you're starting. You have to have your theoretical orientation. So those of you who are eclectic, reach out to me and we can have a conversation about it too. But I kind of stand 10 toes down that everybody needs to have a solid theoretical orientation before they choose the therapeutic modality for their client.
Well, when people are looking at programs, and like I said, I'm at the GW Society program. um I think it's like really important that people choose one approach. That's what I tell them, to go to a school that teaches one approach,
Yes,
right? Like, I just think that if you get grounded, it's hard enough to get grounded in the theory, but if you're trying to do too many in your
yes,
studies, that you're
yes,
grounded in nothing.
yes,
And also, like, I have a really deep respect for psychodynamic work, which is how I train,
yes,
in the respect that I think that the understanding and formulation about people and their internal operations is really good. That's what I take from it. And that doesn't mean that that's the modality that I use most in my work, but it's like what you said, you have to have an awareness of what your orientations are. You have to have an awareness that, hey, I'm formulating with psychodynamic theory, but I see teenagers, so I'm doing a bit of this and I'm doing a bit of that, but awareness of what you're doing,
yes,
right?
absolutely. I think that's the challenge that people don't have the awareness. And so they're going out there and they're doing all sorts of things and subsequently wondering why their client isn't making progress.
Right.
And then sometimes the client isn't making progress because they're resistant to change, but sometimes they're not making progress because we ourselves are not grounded as clinicians. And so that would kind of be like, going to the doctor and I'm not making progress, and it's because the doctor gave me the wrong approach. They gave me the
Mhm.
wrong treatment, right? And so is that on me? I've been adhering to the treatment that the doctor gave me, or is it on the doctor because they gave me the wrong treatment? And so I again, I have we are healthcare providers, and I think sometimes people in mental health don't see themselves that way. We are healthcare providers and we are healers, which is why heal is in the word health, right? We have to take our work seriously. It's not flippant. We are not people who are just having elevated conversations with
Mhm.
clients. We are not elevated friends. We are professionals who must take our work and our craft seriously because clients are depending on us. And if we don't take our work seriously, it not only affects that client, but through parallel processing and isomorphism, it affects that client and all the people that are in their ecosystem. It affects the next generation that is coming behind them and the generations that come behind them. My fear, Dr. Linda, is working with a client and I mess up so poorly that 3 generations away, they are still dealing with the same exact trauma that my client is dealing with. That
and
means,
you've turned them off from therapy, like that's, it's like, first do no harm, you
right,
know
right.
um but you're absolutely right. And also, I don't think that I understood this until recently. But I mean, well, recently in the recent decade, I becoming a good therapist is a work of a lifetime.
Yeah.
And I'll be in a webinar or something, and somebody that I know, either somebody I taught or mentored or whatever, they're like, "What are you doing in here?" And I'm like, "I'm trying to learn just like what you're trying to." You know what I'm saying? It's like I was in a webinar the other day about bilingual testing,
Yeah.
right? And it's like I didn't know anything about it. I'm like,
Mhm.
I've learned like so much that there are people outside the United States that are like trying to normalize a whole bunch of things. And I'm like, I feel like every day I've learned something, either
Yeah,
about therapy or assessment, but you have to be open to it. School is just the starting point.
that's right. That's right.
And but I think your point about orientation and having one and giving people in the book, which I want to take it back to for a second, in the book you give people the framework within their orientation to
Mhm.
ask questions, to self-analyze, to do this, to do the work of questioning our clients, and how do we even challenge our
That's right.
clients, which goes back to one of my earlier questions. Is sometimes you have to say, like, you said this and this and this, but this is a reflection of your pattern about how you do, this,
Mhm.
this, and this. And, I wonder what race has to do with it. So, you have to like still sometimes um push and nudge. And I think your book, respecting the theoretical frameworks of many practices, helps, because I feel like that your inclusion of that was supportive, the
Yeah.
therapist, because being a good therapist is not easy.
No, it's not. It's not. And I love what you said, Dr. Linda, too, around around the fact that we have to continue to be in training. I think about my friends who are medical doctors, and there'll be times where I'll reach out to them and they're like, I'm reading these articles right now, or I'm studying, my one of my clients has this particular issue. So I'm going back to my journals, my journal articles and research, and I'm gonna go to this particular conference or training to learn more. Again, I think that it goes back to counselor and mental health provider identity, in that those 2 or 3 years that we are in our graduate program at the master level, and then maybe those extra few years if we get a doctorate, they are only the foundation of the work. They are not the end point. You are not done with learning because you earned that degree. You must continue to learn. And this book in particular, being one that can be helpful on your learning path. Of course, I'm going to promote the book because it's one that I wrote, and I know the intention and the work that's within it. But there are other books for clinicians that are listening. There are other books that you can also be reading, and they are on audio too. So you don't have to just read. If reading is not your thing, but you like planting and gardening, put in some headphones and listen to an audio book that'll still help you continue and cultivate your work as a clinician. Don't stop just because you have the degree, because that's not helpful. Your clients are changing because
Hmm.
world is changing, society is changing, politics are changing, acceptable things are changing. And so if you only rely on education that you got 10 years ago or 15, 20, 30 years ago, that is outdated information. That's like reading a textbook that's 40 years old. It doesn't apply anymore. So it's not the most helpful. You can find nuggets from it, nuggets, but it is not the most helpful in terms of foundation
I want to turn
or
to talk.
continuation, rather. Sorry.
I want to turn to talk about trauma, because
Yeah.
it's my area, one of my areas, and one of the ones that it's just super difficult to deal with
Yeah.
our field around issues, particularly issues around racial trauma. Um, and so, the whole drill. Our DSM is centered around um, trauma, PTSD based trauma. And, there was decisions on a couple of occasions to exclude racial trauma, to exclude developmental trauma. Um, and I contend that we underestimate look at, we underdiagnose trauma.
Yeah.
And also, there's this whole industry around trauma. I'm not going to name no names, but
Yeah.
because it's not that kind of a party today.
Yeah.
But and it's all about coping and processing,
Yeah.
right? And it sort of excludes the idea of empowerment, which is one of the things that you really that undergirds your book.
Yes.
Um, and seeking redress, justice.
Yeah.
And so I just wanted you to speak more about like why you included a whole chapter on trauma. That's my interest. We could have like a whole show on just that. But talk to me a little bit about like treating Black women for trauma.
Like we mentioned earlier in the conversation, it is quite likely that at some point in a Black woman's life, she is going to experience trauma. And, trauma is not, trauma is more than what we thought it was initially. We
Mhm.
think abuse and we think of neglect, and maybe we think of exposure in terms of trauma, but trauma also can show up in various ways in our lives, and outside of our control. We can be the most educated, within proportion. We could be the most educated racial and gender group and still have, you know at one sweep, 300,000 of us lose our job. And that's traumatic. We can be the most healthiest type of woman and do all the things and advocate for ourselves. And in a heartbeat, um, our child can die in childbirth, or we can die in childbirth. Our closest friends can die in childbirth or in that process. We can do all the things that we are supposed to be doing that's well and good and aligned with us, and still trauma will come face to face and meet us in a particular moment of our lives. And to the point that you were making a second ago, Black women, in my opinion, are often misdiagnosed, and trauma is not a consideration for their diagnosis. People are quick to diagnose us with, generalized anxiety disorder or major depressive disorder. And medical providers are giving us medication for those particular disorders, when in fact the actual issue may be trauma, and we don't need the medication per se. But what we need to do is to be able to address the root of that trauma. And if they keep misdiagnosing us, similar to what I said before, if a client had cancer but you diagnose them with hypertension, you're not addressing the cancer, and you may be causing different health issues because now you're treating them for a disease that they do not have, right? Like, so I needed Black folks in particular, and clinicians in particular, to understand what trauma really is so that they can start properly diagnosing. And that trauma chapter is in the other part of the book, not the lifestyle type, because that section is very specific to clinicians. See the trauma for what it is. Stop diagnosing people with things that's not appropriate. Diagnose them with the trauma and treat the trauma, and be intentional about how you do that. I did put some assessments and things in there too, because like you mentioned, there's a whole industry that's centered on trauma, but that industry rarely includes us. It includes everybody else, right? We must not have trauma because that's how it seemed. Because if we do have trauma, then that means that they have to address that their systems have created the trauma, right? Depression and anxiety, that's about us individual. You are depressed, you are anxious. But trauma is a disorder that is external to the individual. A person has trauma because somebody has placed a traumatic experience on them. And so that means that there is a social accountability that has to be in place when we're addressing trauma. And there has to be a systemic system, there has to be a systemic awareness that's in place when addressing trauma, especially racial trauma and gender trauma. But sometimes providers, because of their own counter transference, are afraid to address the trauma because it means that they have to acknowledge that it's possible that their people and their systems have created the trauma that we are currently experiencing.
When I'm training on assessment, one of the things that I talk about is like, what is the child doing?
Yes.
versus what has been done to him,
Yes.
right?
Yes.
Or what has been done to her,
Mm-hmm.
right? And you're right. It is, where's the locus, right? And so the surveys say that people of color are judged as a group, and people that aren't of color are judged as they get so they put things on people that are individual, right?
Mm-hmm.
And they judge them and more compassionate toward individual failings. And then
Yep.
people of color are judged as a group. So if one person does something, they judge everyone.
Yep.
I just wanted to acknowledge that was my last one of my last questions, if not my last, is this issue of the assessment tools for assessing trauma are in the book. Dr. LaNail issued a lot of ones that are free. I wanted to add another one.
Yes.
Yukon Racial Ethnic Stress Trauma Survey by Dr. Monica Williams. She has a whole website on trauma. She was one of my inaugural guests on this show. And she is an amazing, all of her assessments are free. Um,
Yay. Shout out Dr.
so
Williams.
so I wanted to ask you to give me your sort of takeaways and what's going on for you next. Like you're out there promoting the book, so like tell me your takeaways from what you want to leave us with the book, and then what you're doing next.
What I want to leave us with is for both Black women and for all clinicians is that you can be empowered. You are empowered to make the changes that you want to make in your life, whether that is your life individually as a Black woman or whether that is your life as a clinician who is working with Black women. You, as a clinician, can read this book, get the information you need, and feel empowered to support that Black woman who is going through her own healing journey. Remember, we are professional healers and we must take ourselves seriously in that work. And as Black women, remember that therapy is a beautiful process. It is a little scary because you have to open up some wounds that you've kind of been suppressing, and it can get a little messy because you end up needing to think about things that you hadn't wanted to think about. But kind of like in the medical field, if you have an infection in your body, you got to cut it out a little bit and let it come out. You got to do something intentional to let that infection come out. And so that's what therapy is. It's a little uncomfortable at certain points, but what's in the end is so beautiful. What I'm working on is, of course, continuing to support and promote the book, The Essential Guide for Counseling Black Women. And I am also finishing up my second manuscript, which is on supervision and leadership for diverse clinicians. And so I have to sandwich it, right? And so here's what we're doing for our Black women. And then those who are in leadership, this is how we support those who are working with us that have diverse identities that are different than ours. And so that book will also be published by Norton, and it'll be coming out in 2027. So I get to have a book that comes out in 2026 and a book that comes out in 2027 as well. And aside from that, Dr. Linda, I am taking time to rest. I run a business, Onyx Therapy Group. I get to be the department chair at Trinity Washington University. And I'm at a different place in my life as an empty nester. You know, my daughter just graduated college, and my son he's about to go into his sophomore year at Florida A&M. And I am being intentional about sitting down. I'm being intentional about taking a nap when my body wants to take a nap. I'm being intentional about maybe taking a walk instead of running because maybe my knees can't handle it, but I still want to be moving. I'm being intentional about sitting down, about sitting down. So after this next manuscript is submitted, I'll be spending several months sat down.
Right. Rest as resistance.
Rest as and I love that book too. I have that book in my library.
Yes.
I love that book.
I just want to say that this has been an amazing hour, and I wanted to say thank you so much, Dr. LaNail, for being with me today.
Yes.
This is Linda Fleming McGee from the Multicultural Psychologist. I will see you all next time.